or without health insurance, doctor visits at a hospital can be very expensive, and relying on emergency room care is gambling with your health. Now, for more and more people, community health centers are a viable option for quality care. But these centers face big changes if proposed funding cuts come through. We'll find out more about these centers and their future next on Black Issues Forum.
Quality public television is made possible through the financial contributions of viewers like you, who invite you to join them in supporting UNC TV.
Hello, welcome to Black Issues Forum. I'm Deborah Holt-Noel. Healthcare is a big buzzword these days, almost as much as words like jobs, economy, even race. One of the reasons is because our health is so important to us. Yet quality care is oftentimes a question of money and access, especially when you need it most. One institution that has tried to meet the needs of patients in terms of care and economy are community health centers. Today we'll find out more about these centers in North Carolina, who they serve and how they're funded. But first, we bring you this story about two patients served at a community health center in Carborough.
Good morning. How are you doing? I am very well. Oh, it's afternoon now. Good afternoon. How you doing? I'm good.
I go to Carborough. I think it's Carborough Community, but I always just call it Piedmont Health Services in Carborough. I go there often. I have a great doctor now. As far as the level of care, or I like to say customer service, they're great. Before I started going to Piedmont Health Services, I was basically a Google person and a book person. All of these years, if I felt that something was out of place or if I felt like I had symptoms of something, I would run straight to the computer. I would run to a book, and I would try to look up and try to isolate what my issues were.
But when Crystal Ragland awoke one morning with hemorrhaging in her eye and visits to a medical provider revealed she had hypertension and had bypassed a stroke in the night, she realized self-diagnosis was not the answer. For Crystal, receiving quality professional health care became a matter of life or death. Unfortunately, she does not have health insurance, and neither do nearly 1.7 million other North Carolinians, according to a 2009 report by the North Carolina Institute of Medicine. In fact, a 2010 Kaiser Family Foundation report found that ethnic minorities account for about 50% of the uninsured in America. Crystal's situation is a lot like that of Ima Benoit Petitjean, another patient at this community health center who requires regular doctor visits to manage her diabetes.
2 years ago, I didn't become unconscious, but I was very near, and I felt just very horrible, hot and feverish and headache and everything like that. And I just went to an emergency service, urgent care, and that's when I was diagnosed. The first thing that comes to your mind is, go to the big hospital, and then you get the bill. And then I was like, I think there's a better way there, the doctors have gone to the same schools. They are the same doctors, and they take care of you even better because it's small.
Piedmont Health Service is a community health center organization. Health centers started 45 years ago, and the idea of health centers was to make sure there was access to care for people who were pushed away from access to normal care in health care. And for years that was either because of their finances, lack of insurance, or the color of their skin or the language that they used. And you fast forward 45 years later and a lot of the same issues still exist. It's just actually what's been expanded is actually people find it more difficult to access care for the financial reasons, whereas before it was other more complicated reasons. Now it's also financial reasons that are really hitting the middle class in a way that we hadn't seen for decades. We've grown significantly over the last 7 years, but especially since the healthcare reform started, so that We've added, currently we have approximately 355 employees that work for us. And these are jobs with benefits. They're jobs that are have regular employment. We've not laid off anybody. In fact, we've expanded during hard times. And we think that this is a nice, steady income in lots of locations in the central part of the state where people wouldn't necessarily find employment or would have to travel far.
How you doing? Good.
Dr. Abigail DeVries is one of those employees at Piedmont Health Services, on staff as both Associate Medical Director and Family Practitioner. She believes Piedmont Health is a benefit not only to patients, but to the entire healthcare community.
It's incredibly important. I mean, we keep folks out of the ER, so one thing, we decrease their costs, but we are able to improve their health care by providing preventive services, including nutrition therapy, generic medications at our pharmacy at a very low cost so that they can afford to take their medications and not have those complications from diabetes and hypertension that could cause them heart problems and like I said, land them in the emergency room and possibly being hospitalized. So it's a very valuable service to the community.
The Carborough Community Health Center is one of 6 operated by Piedmont Health Services and is really designed to be a resource to the community, providing not only access to affordable health care, but also WIC nutritional services, senior medical care, even voter registration. In addition to receiving their care at Piedmont Health, Crystal and Ema also share the same place of employment and they're best friends as well. Maintaining good health is necessary for their jobs, to be there for each other and the people they love, and even to achieve their dreams.
We're going to be auditioning for BET's Sunday Best in a couple of weeks together. So we're really excited about that.
I give myself away so you can use me.
When I was a little girl, I used to pray to God that I'd live to be 100. Being healthy for work is extremely important because, you gain these relationships with people that come into your store every day. And so, you want to be on your A game as much as possible. And I never want to be limited. I'm not interested in being limited as to what it is I can do on any job or in life at that fact.
Hands, Lord, I'm longing.
And we're back talking about community health centers and their survival. And I'd like to introduce today's guests. We have Lydia Fuse Mason, the Chief Financial Officer of Piedmont Health Services. Reuben Blackwell, President and CEO of Opportunities Industrialization Center, Inc., a community-based human services not-for-profit corporation in Rocky Mount, North Carolina. And Ben Money, CEO of the North Carolina Community Health Center Association. Welcome, all 3 of you, to the program. Thanks so much for coming out.
Thank you, Debbie.
Let me just get some numbers here, Ben. What's the volume of patients served in the entire state?
There, in 2010, there were 450,000 patients served by community health centers across the state of North Carolina.
And how does that compare to those being served at other hospitals and urgent care centers?
Well, community health centers are different than a hospital. We provide not only primary medical care, but also dental care, pharmacy services, and behavioral health services all under one roof. So we serve a unique niche in the population.
Now, Reuben, are the people who visit these community health centers, are they only uninsured, only people who simply can't find the care elsewhere?
No, community health centers are set to serve everyone. When you look at our range of customers, we reflect the entire community. So we do have people who do not have insurance or not able to afford insurance, or they have insurance that it's not worth the paper that it's written on. We serve people who have public insurance, Medicaid, Medicare. We have people who have private insurance, and we have people who pay out of pocket for services. But we're set to deliver the same quality primary care and other ancillary services that anybody needs and deserves in our society.
And so you don't have to meet a certain income limit in order
You just have to have a need to be seen. And really, community health centers are really concerned about the infrastructure of care in a community. So we put as much emphasis on preventive health care as we do on chronic disease and illness as well.
That's so important, the preventative piece. Lydia, can you share with us a little bit about a program that the two girls in the story were able to take advantage of? And just explain to our viewers a little bit more about the Chamber of Commerce program.
That Chamber of Commerce program spun out of a need in the community where we saw that there were individuals who made too much money to apply for the Medicaid, but did not make enough money to afford decent health care insurance. And so what we did was we partnered with the Chamber of Commerce in Chapel Hill, Scarborough, and developed a plan whereby members of the chamber could have their employees come to see us for a flat fee. And what that does is it gives a person an opportunity to understand when they come into the doctor's office exactly how much money they're going to pay out of pocket for their preventive care and exactly how much money they're going to have to pay out of pocket for each of their prescriptions. And so that gives individuals a comfort level to know I only have to come out with this and I'm not going to get another bill afterwards that's going to require me to pay an exorbitant amount more.
Let's talk a little bit about the funding piece. First of all, how are these centers funded? Where's the money coming from?
Okay.
Ben?
In North Carolina, it's about $56 million comes from the federal government to help support care to the uninsured. But health centers also generate revenue from Medicaid, Medicare, as well as private insurance. They also need grants and foundation support to continue to provide the services that exist.
Now, we know that these centers have, in the past, received strong bipartisan support at the federal level. Talk a little bit about the support that these centers have received recently on the state level and what threat possibly exists.
Okay. Health centers do receive bipartisan support at the federal and the state level. One of the challenges that exists is just the fact that, with the economy, with concerns about, federal debt, there is an effort to reduce the federal budget, but there's a clear recognition of the fact that community health centers actually save money because, like the young ladies in the story, if their conditions had gone untreated, they would have wound up in the hospital, and the cost would have been much, much higher.
Let's talk about that cost, though. I mean, Lydia or Ben or Ruben, comparatively speaking, I know that the program, the Chamber of Commerce program, allowed for $60 for a visit. What kind of cost are you talking about if you don't have insurance and you just go over to Mission Hospital or to Wake Med or wherever?
What we found is that when you go for an emergency visit, you could spend up to $1,500 in an emergency room. But if you come to a community health center, we find that our patients spend on average $400 a year for a patient, and that usually is about 3 to 4 visits a year that they have for that money. Our cost, we have to be economical. We have to understand how to leverage our dollars. We have to understand how to manage our money, because when I started with Piedmont in 17 years ago, our federal dollars made up 75% of our actual budget. Now our federal dollars make up 20% of our actual budget. But we have to be there for the patient. So as far as community health centers, they are the most economical way to have quality health care that is in the U.S. right now.
But as recently as 2011, there were threats to cut funding. Can you talk a little bit about what that would have meant for North Carolina? It didn't go through. It passed the House. The Senate rejected a funding cut. But Ruben, what would that have meant for North Carolina centers?
Well, Ben might be better to speak around the whole state. I can just say what would happen in Rocky Mount. If we were not able to receive the support and help that we receive, you asked a question earlier about how much does it cost you. Well, we have a sliding fee scale basis. According to what you make, is what we would charge. And so you could come in with a $5 copay or a $10 copay or a $15 copay and receive a great experience with a provider, and then be able to go across the street and purchase your pharmaceuticals for your condition for $4. Now, none of that can be done if we don't have the ability to subsidize our operations. The difference between community health centers and private care is that we are there to provide a safety net and a support for the whole community. What we're able to do is take the pressure off of private practices who have other bottom line issues to meet. And as Lydia said, we have to run efficient operations. And as the state of North Carolina tells us, they're not in the business of funding inefficiency. So when you get money from the state or the federal government, you have to prove to 100 people 150 different ways, why their investment is placed in an appropriate manner and how it leverages back to the community. If it weren't for community health centers, emergency rooms would be flooding over, private practices would be flooding over with people that they cannot serve, and no good physician wants to turn people away because they can't afford to pay. We're here to help take that pressure off of private practices who have other needs and other means. We're not here to make money. We're here to serve people, and we're here to make sure that the health of America and North Carolina is secure.
Now, Ben, is there funding to meet not only the expenses, but evidently there is an increasing volume of people using CHCs. Is there funding to support the growth?
Actually, in April of 2011, a year ago, Congress cut funding across the board, and community health centers also received a cut. $600 million was taken out of the base funding for health centers. Fortunately, there was funding set aside in health reform, the Affordable Care Act, to expand health centers. That money was instead used to shore up the existing health centers. So across the state, we had 30 communities that had applied to become new community health centers. And we had anticipated that at least 20 of them would be funded. We actually had 19 that scored very high. Only 2 received funding because of that budget cut. So right now we've got communities across North Carolina that are desperately waiting to have access to care and are unable to because of the budget compromise of 2011. So it definitely did affect the health centers, as well as there were grants that were to be made available to community health centers to expand care to those newly uninsured because the rolls continue to grow. That funding was not allocated as well. So health centers are essentially functioning on funding from 2006 to try to make up the care that comes in the door every day.
Let's talk about an issue associated with perhaps a viewpoint that these community health centers are serving certain populations. How much of an issue is it that there's a question around service to illegal immigrants? And I would like for all 3 of you to address that question, starting with Lydia.
Well, we do have the don't ask, don't tell type policy because our major concern is for the patient. That patient is here, that patient is within our community, and if we don't service the health of the total community, then we put our community in jeopardy. So our goal and our aim is to give services to our community, whomever they may be.
I'll definitely back that up. Deborah, our issue is that for residents of North Carolina, if you're in North Carolina and you live in and work among the people that live in North Carolina, we need you and want you to be healthy. We are much less concerned about where you came from or what your status is related to the federal or state government than we are about what your status is because you're sitting next to me, or next to you or your neighbor or your child. And I think it's much more important that we have a culture that is attuned to making sure that we put a premium on health and education to make sure that we have the best quality of life for everyone in the entire state to be able to operate and live. A sick and a weak and an uneducated North Carolina is bad for everyone. And if you want to calculate cost, you calculate the cost of epidemics, calculate the cost of mass ignorance, calculate the cost of the lack and the inability of people to be able to operate on a par with each other. How do you compete economically with the rest of the world with a sick workforce? And that's why we do what we do.
And the majority of people that we see at community health centers are employed. They're folks that are working. And so the services that we provide improve the economy because people are able to go back to work, to continue working, to not spread anything that they may have to someone else, their coworkers, if they have a cold or a flu. So we're providing care to anyone that walks in the door. And we think that that's not only good business sense for North Carolina, but it's just human compassion.
Absolutely. Well, Ben, understanding that these are tough times economically and everyone has to belt tighten, what needs to happen? Even creative strategies to provide for the health of the citizens in our state, and also to try to deal with this economic crisis that we're continue to deal with.
We feel like community health centers are that solution when it comes to healthcare delivery because most healthcare issues can be addressed in a primary care setting.
But everybody has to cut, right?
Well, would you cut the things that are actually saving money? That's the key thing. George Washington University did a study recently and said that community health centers save 62% of the healthcare dollar simply by keeping folks and providing care in a setting, in the community, in primary care, and offering the services that keep people working, keep people healthy, saves money. So to throw out something that's saving money is pound foolish.
Right. And the whole theory is that you want to have the right care. You want to have it at the right place, but you also want to have it for the right cost. And that's where community health centers are. We are trying our best to maintain that three-legged stool. And any one of those legs, if it's short, it unsteadies the whole stool and the support system.
And one of the things that I think is also a premium value and return on investment is that we put a lot of emphasis on patient education and having the patient take information that they can apply to themselves every day. The thing that to me was striking about the interview that you just showed with patients of Piedmont is that they were able to take that care that was given and then translate it to how it impacts their daily decisions about what they eat, what they do, how they exercise. Community health centers put a whole lot more emphasis on really proactive health care that people can do themselves. You know, your patient already had a hunger for and a thirst for knowledge, and she was already doing the research. But when you combine your own research along with, doctor's care, and then we can take more than the 15 minutes here and the 20 minutes there and work with you in different kinds of settings, then you have a healthier person. A healthier person is better.
As viewers become aware of the issue and so forth, I think that a lot of times we feel that we don't have any power to make a change. What do people need to be doing to be actively engaged if they care about this matter?
One of the things that I would say, if viewers really care about community health centers or how to access community health centers, there is a website that's www.saveourchcs.org. And that's a website for advocacy. And everyone can be an advocate. If you believe that if you are an employee of, if you are a patient of, if you know someone who works for a community health center, it is very, very important to be an advocate and to let others know how important this community health center has been to your community. One thing about community health centers is basically when you've seen one, you've seen one. And the reason for that is because we fit in where our community is. And we pick up what we need to pick up in order to make a healthy community.
Well, Reuben, Lydia, Ben, thank you so much for sharing with us, and I hope that our viewers have gotten some good information about community health centers. For more information or to get in touch with today's guests, visit us online at unctv.org/BIF. You can find links to email us your comments and join us as fans of BIF on Facebook. Or you can call us on the BIF line at 919-549-7167. Be sure to meet us right back here each Sunday afternoon at 4:30 for Black Issues Forum. I'm Deborah Holt-Noel. Thank you for spending your time with us.
Quality public television is made possible through the financial contributions of viewers like you, who invite you to join them in supporting UNC TV.